Hello, welcome to this presentation about critical thinking for health information seeking. I'm Veronica, I'm a health librarian employed by the NHS, and this presentation has been created for Health Information Week 2021. Day 5 has been titled "Oh, I don't know what to believe," to reflect the experience of many of us when we look at information on the web. There is such a vast array of information available to us online that the World Health Organization has labelled it the infodemic of health information, which has a slightly negative connotation, really trying to get over the fact that with such a vast array available to us, it can be very difficult to know what to believe and what not to believe. So the aim of this presentation is really to show you how to use toolkits or checklists when you're looking at information, particularly on the web, but these can be applied to written or printed information as well. So that when we're seeking information, whether it's about symptoms that we might be experiencing or illnesses that we have, and how to sort of treat or maintain our health through those illnesses, whether it's about medicines, whether it's about healthy lifestyles or dietary behaviour, in whatever case that we are seeking information about our health online, we need to be looking for trustworthy and evidence-based information. By evidence-based, I mean research that has been performed by clinicians, research that has been repeated many times so that there is a solid bank of results and evidence which support particular treatments, particular recommendations, particular diets or whatever it might be, but that these are things that have been tested scientifically, not just speculation or even worse, made up information. So we will, throughout this, explore some strategies to help you decide what information you can trust. And the first thing really to say is that there are certain websites which are very much more trustworthy than others. So the NHS website, which has a very simple web address, www.nhs.uk, will bring you to this website, where there is a health A to Z, looking at symptoms and illnesses and health conditions, and a medicines A to Z, again going through the list of medicines that you might be taking if you need to look up side effects or advice about dosages or anything else. So you can see that you can very easily find the sort of information that you might need on here. Let's go back. Okay, and a second website that many people like to consult, which again is full of reliable information, is the patient info website. Okay, which unlike the NHS site, which is arranged as an A to Z, this one is arranged as topics, and often with the most sort of relevant topics for a particular season. So obviously at the moment we're in the middle of summer. Hay fever is the most prominent topic on here. Sun safety, possibly exercise, but plenty of topical information there, but obviously there is a search site as well, another search box up here. So you should be able to find information that you need quickly. And we'll use this website a little bit later on so I can just demonstrate some of the lateral reading information that we're going to be talking about in the next few minutes. Finally, many health websites have a health quality mark on them, and I have made another video on this playlist specifically about the health quality marks. So I won't talk about those anymore now, but I will refer you to the other video on the playlist, which you might like to watch, talking about health quality marks. Okay, so obviously when we're searching for the information ourselves, if we look for the NHS website, if we look for patient info, the quality mark websites, we know that we should be looking at good, useful, trustworthy information. But what do we do when a friend or a relative pings us the latest health claim on social media, something that they've suddenly seen, maybe a headline about COVID or vaccinations, and you can see that it's being shared very many times. How do you know whether that information is correct? Since the advent of the World Wide Web, we have all been exposed to vast amounts of information. The amount of information on the web just increases exponentially. And on the one hand, that is a very good thing. We can find out pretty much anything we need to find out from wherever we are in the world. But on the other hand, it can be very difficult to sift out the good and reliable information from the unreliable information. And it is now so easy to make a very, very professional looking website. For just a few dollars, you can buy fantastic web creation tools, and anyone can put a website up very quickly with professional looking photos. They can keep it updated, but how do we know as consumers that the information on that website is reliable and evidence-based? Some of it may contain misinformation, information that is not necessarily accurate. Some of the evidence, some of the information out there is active disinformation, information that has been designed to mislead you and can be actually dangerous. Some of it is just pure speculation, and some of it is marketing. So we do need some tools to help us decide whether the evidence we're looking at is actually going to be good for us and good for our personal healthcare or not. So we need to check the facts. Now, professional fact checkers read laterally, and I'll explain what I mean by that. We have all been taught since early childhood to read vertically. We start at the beginning of a book or a newspaper article or a magazine article or a web page. We start at the top and we read from beginning to end. Now, with so many websites out there, a professional fact checker actually reads less on a website than we might, but probably learns more, because rather than reading vertically, they read laterally. And what that means is that as they go through a web page, they will open up other tabs on their browser, and I will demonstrate this in a little while. They open up other tabs on their browser and they check the information as they read through the website. And sometimes they will find very early on that the information on that website cannot be trusted, so they won't continue reading. So that's when I say they will read less, but they will learn more. We might read the entire content of the website and still maybe not know whether to believe it or not. So we need to learn to ask questions. And the 4 basic questions are who created the website, what is the purpose of the website, where was the website created, and when was the evidence, not necessarily the website, but when was the evidence updated. So how will we find out who has written the information? Well, we need to look through the web page and look for an author on the page. We need to decide whether the author is a person or an organization. And we would need to open up another tab once we've found the author. We need to open another tab and we need to search for that person or that organization's name and find out who they are. And that will help us decide whether they are a reliable or qualified person or organization to give us the information that they have put on their website. We also need to find out what the purpose of the website is. We need to have a look and decide, is it marketing? Was that organization perhaps a company that produces health supplements or vitamin supplements? Are they trying to sell us their product? Are they trying to persuade us of something, or is it sort of active propaganda? Is it a website that's promoting a message against vaccinations, for example? So we need to look carefully and decide, is it giving us balanced information, or does it seem to be very biased and only giving us one side of an argument? We need to decide whether it is disinformation, and in that case we'll need to actually open another tab and type in the maybe the headline and search for that and see if there are other websites that back up this information or not. Or is it reliable information? Is it scholarly? Is it educational? Has it come from a university department, a sort of top quality university department? Has it come from an accredited healthcare organisation? Okay, where has this site been created? Now, this can be important when we're looking at health information because you need to decide whether the information is actually relevant to you in your geographical region. Now, certainly our local public health and county council have some web pages with lots of local services and advice for health information in and around Somerset. So those pages would be very suitable for us to look at. If the information has come perhaps from an overseas country, we may find that names of medicines are not the same as they would be in the UK. Dosages may not be appropriate for people based in the UK. Medicines that are available in one country may not be available in another country. So the geographical citing of a website can be important when we're talking about health information. And I've put as the headline, when was the information last updated? We have to be very careful about this. Health information does change over time because as new clinical trials are performed or new evidence emerges from patients being treated either with one drug or with one regime of treatment, advice can change over time. Now, the health websites that have quality marks, they are reviewed every 3 years to make sure that the evidence on them is still the most up to date, the most current, the most useful. So when we're looking at a web page, we probably need to make sure that the evidence on there has been produced within the last 3 years. And that doesn't just mean checking the web page, the date of the web page. We actually need to look for the source of the evidence that a web page is presenting and check that that has been updated recently. Because as I said a little bit earlier, it's very easy now for people to put up a professional looking website and actually change the dates, make sure that it looks as if it's been updated within the last month, but the evidence on there may not be, the photos on there may not be. There are an awful lot of websites that reuse photos that were posted 10 years ago and from very different regions of the world compared to where they're being claimed to have been taken. So it's very, very important to look carefully at the evidence on a page. So toolkits and resources that we can use whilst we are laterally reading, we can use some of these toolkits to help us assess the information on pages. So we have Discern, which has actually been developed specifically for looking at health information. We have the CRAP tool, much beloved by students, which has been designed really looking at any information, not necessarily just health information, but for looking to see if any information on the web is reliable before being used in research projects by students either in secondary schools, probably even primary schools or universities. There is the Share checklist, which it has actually been hosted on the government's website, and that has been very specifically designed to make people think before they share claims on social media to try to stop the spread of disinformation. And another resource that I'm just going to recommend is a series of videos produced on YouTube by an organisation called Crash Course, and they have one particular playlist on navigating digital information. And if you have time to watch it, I would highly, highly recommend taking a look at their videos, because they really are very informative, very accessible, and will take you through in very much more detail than I'm able to give you today. So the Discern project, if we take a look at the website, this is a free to use tool. It has been created, I think it was funded by the NHS executive, and it's hosted at Oxford University, so we know it has strong academic basis. And if we actually have a look at the instrument, and as I say, this is free to use, you can look it up on the web and you can print out this PDF if you wish to, but there are a series of questions that you can work your way through. So if you have a website that you're looking at, I'm actually just going back to the patient information website, and you have your Discern tool open on another tab, or as I say, you can print this out. And you literally can read through each of these questions and rate the information on the site. And there are some handy hints for each question, pointing you to what you should be looking at on that site. Is it clear when the information used or reported in the publication was produced? So you can work your way through and decide whether the information on a site is reliable. So that's the Discern tool. If we go on to the next one, the CRAP test. So again, the acronym stands for currency, meaning how current, how up-to-date is the information, how relevant is it to you and to your needs. What is the authority of the person who created the information? Are they qualified to give you this information or not? how accurate is the information, and what is the purpose? Again, is this site designed to sell you something? Is it designed to inform you and educate you? Is it designed to try and persuade you to change your opinion about something? So if we go to the site, and I'll just show you again, it is a completely free to use tool, and you just click start the test. And again, there's a series of questions that you work your way through. So we start. So currency, the information is recently published or posted. So if we step back to here, let's have a look. When is hay fever season in the UK, and how do you avoid the symptoms? So let's have a look at this bit of information. Okay, so this was authored on the 7th of May 2019. So we should know that that's within the last 3 years. So we ought to be able to rely on this information and know that it is current. And there we've got some probably very useful information about the differences between hay fever and coronavirus. And that was updated on the 12th of April 2021. So obviously very current. So, you know, the very first check on the crack test would be yes. Okay, so we can, or you can, go through that checklist when you're looking at a website. And finally, the share checklist. So again, very similar things. You'll notice that each of these are really asking you to do the same tests. Look for the source of the information. Look beyond the headline. Look it up on a second tab on the net so that you can check whether there are other websites that give you the same information. Again, analyze it. Look for reliable sources. Check whether the images are genuine or whether they've been retouched, and you can search for images. You can use the Google image search and actually check whether an image on one website has been used on many other websites, whether it's come from someone's social media account, and look for errors on the site. Okay, let's just have a quick look. So this is the share checklist, encouraging you to be careful with what you share. And if we click here, again, we can have a look at the checklist, which you can download if you want. Keep it beside you when you're looking through a website. Okay. Now I'm just coming onto this crash course, Navigating Digital Information, just to show you. I've put a QR code on there. If you want to scan it, that will take you straight through to the playlist. I won't play anymore, but you will find that there is a playlist. I think it has 11 videos in total, but each of them is roughly 15 minutes. And if you have the time to watch them, I really would encourage you to do so, because not only are they very informative and educational, they're actually a fun thing to watch as well. So I really, really recommend those. Okay, if you have done your own lateral reading and you haven't maybe found everything that you think you wanted to find about a site, you can always use these fact-checking websites. These are professional fact-checking websites, which again are free to use. Now, Full Fact is UK based, and you can type, if you have a headline or a particular article, you can type some of the facts in here, and then you can check whether the information that you have is reliable or not. Again, there's a lot more advice about how to spot fake websites, fake information. There's plenty of information here that has been already checked. So this is a great tool to use. Snopes is very, very similar. It's an American-based organization. So as we know, the web is a very, very global tool. So you may well be reading something that's been outputted from America. You can check on Snopes as well to see if American fact checkers have had a look at the information that you're looking at. So get rid of that. And this is quite useful, again, around COVID. The World Health Organization has a part of its website. Sorry, that is loading very slowly. I apologise for the delay there. Oops, let's go back. Sorry about that. Let's try again. Here we go. Right, the World Health Organization has a Mythbusters page on their website, again dispelling the sorts of myths that have grown up around coronavirus and giving you the evidence-based facts and dismissing many of the rumours that you might have seen online. So that's very useful. So as you can see, I've got a lot of tabs open. So, you know, this is what your browser will look like if you are laterally reading as you read a website. And we spoke about, you know, checking the authors of websites. So, you know, this particular piece of information has 2 authors. So a very simple thing you can do is literally copy the name, copy it, open up a new tab, paste it in, and take a look. And you can very soon see that Dr. Sarah Jarvis is obviously someone who is well known. She is a registered GP. We can see how long ago she qualified. She qualified from the University of Oxford. She's been awarded an MBE. So we can be pretty sure, and we'll look back and just find another source. It's always worth checking more than one source, but we can be pretty sure that Dr. Sarah Jarvis is someone that we can trust, someone who has the qualifications required to give us reliable health information. Okay, so that's what I mean, in case it wasn't clear, that's what I mean by lateral reading. So we've found some information here. Let's have a look at Ali Anderson. Okay, so this is still on the patient info page. She is a qualified journalist who specialises in health matters. So we will imagine that she is very good at fact checking, because fully qualified journalists will use fact checking as part of their repertoire skills. So again, we can look at her LinkedIn profile, find out that she is a specialist journalist writing about health. Can find out the number of people that she works for. She's working for some proper clinical journals here. So again, we should know that this is someone that we can trust when we read something that she has read about, or that she has written, sorry, that she has written about healthcare. Okay, so that's just a little bit of practice at lateral reading. Okay, so what I really hope that you have taken away from this presentation is the necessity of checking the facts before you put information into practice when you are aiming to take care of your own health, and checking the facts before you share health-related information more widely on the internet. So I hope I've given you some ideas and some strategies that you can work with. It's so important that we all play an active role in looking after our own health, and in doing that, that we actually use evidence-based and reliable information that has come from reliable sources, and avoiding information which does not have the clinical evidence behind it to actually help you take care of your own health. I hope you've enjoyed the presentation. Please take a look at the quality marks video and the other videos on this channel, and happy searching and happy lateral reading.